am
Yeah,
a pregnant person in an underserved community. Talk to me about the healthcare gaps in that community versus
absolutely.
mine.
So it's funny because I worked for FQHC, which is a federally qualified health center.
Okay.
And what I saw working in that community is that you have a lot of women who are everything for everyone. Their priorities are different than, say, your priority, right?
Right.
And we say that the system is broken, but the system is not necessarily broken. It just was never created to target that particular type of patient, right? It
Right.
wasn't designed for marginalized women in mind. Black and brown women are more likely to be ignored, misdiagnosed, or treated with
Yep.
bias. So these are things like bias that they're being exposed to. Access, education,
Yep.
advocacy, right? These are things, and then also access to quality hospitals. I have a story about where I trained. Where I trained, it was at a very prominent hospital. And I remember that there were Black and brown women who came to this hospital to deliver because they knew that they would get better care. The issue is that in that moment was that their doctors weren't necessarily on staff at this particular hospital. So what happens is you go into the hospital just to deliver because I know I'm going to have improved outcomes. However, the doctor who's delivering me or the team who's delivering me, they know absolutely nothing about my pregnancy history, about my
Right.
medical history, right? So here, and then when you lack health literacy, I don't necessarily know how to communicate to this doctor that doesn't know me because I'm what we call a poor historian, because I don't really know the
Right.
translation of the words, right? I don't know how to communicate to this doctor who's never seen me, even though I know that I'm going to get good care at this particular institution. I don't know, they don't know my history, and I don't know how to translate that information because I don't really know anything about healthcare, right? So then you talk about in the postpartum period where a lot of these women have Medicaid, and it was a fight for us to get Medicaid covered up until a year postpartum. So you have gaps in coverage, disrupted prenatal visits, lower access to specialists, and then not to mention things that are in their environment like chronic stress and racism. Constant exposure to racism,
Mm.
constant exposure to just stress is going to increase your risk of health care or hypertension, preterm birth, complications, right? And so you take all of those things
Yep.
and then you get a bad outcome, right?
You know,
They
and,
cannot
and
cancel my visit.